Hi class, in this lecture I'll talk about antiviral agents. The objectives are listed on the slide and they're also listed in your Blackboard module. There are new vocabulary words, please be familiar with these. I'll talk about some of the definitions, however some will be available in your textbook. Alright, so let's start with an overview of the antivirals. First of all, they are going to be discussed in two separate lectures. So we'll have the non-HIV viruses and their treatment, and that's what we'll talk about in this lesson. And in a subsequent lesson, we'll talk about HIV infection and a treatment for that. So just so you know, treatment options for viruses at large are somewhat limited. There have been lots of efforts to develop safe and effective antivirals. Unfortunately, there are issues with selective toxicity, and the reason why is because the viral replication process actually uses human machinery to enable that process. So viruses are what are known as obligate intracellular parasites. So they use the host cell enzymes and substrates to further that replication process. So in terms of developing drugs for viruses, it's kind of difficult to find targets that won't be harmful to the human. Now, the drugs we do have are able to suppress something that would be specific to the virus. So I'm going to talk about a couple of antiviral agents today, and we'll talk about kind of how those antiviral agents have been successful in terms of suppressing virus-specific machinery. So there are numerous non-HIV viral infections. I only have a few listed here on the slide. Like I mentioned on the last slide, we don't have drug therapy for the vast majority of viral infections. The infections I have listed on the slide do have drug therapy. So the herpes virus group, there are more viruses than what I have listed here, but these are some of the main viruses in the herpes virus group. So herpes simplex virus, varicella zoster virus, and cytomegalovirus. We'll also talk about influenza treatment as well. We are not going to talk about drugs for the treatment of hepatitis B and hepatitis C. However, there are drugs on the market to treat those diseases, and there are also drugs on the market to treat respiratory syncytial virus or RSV. Again, we won't talk about those, but I will briefly go over each of these viruses and kind of what is distinctive about them. So HSV and VZV, these are important. We do have drugs to treat both of those. HSV causes infections of the genitalia, the mouth, the face, and other sites. VZV causes chickenpox as well as shingles. Shingles is really painful. It is a reactivation of the infection after the patient's already had chickenpox. Usually chickenpox occurs early on in life, and then shingles occurs later on in life as the immune system starts to kind of wane somewhat. Now we have a vaccine against the chickenpox, or specifically varicella zoster virus. We will briefly talk about vaccines in a different lecture, but what we'll talk about in this lecture are specific drugs that can treat active herpes as well as varicella zoster virus. CMV is another herpes virus member. It's a very important infection. CMV is transmitted person to person, usually through tears, saliva, milk, breast milk, semen, etc. For most people who get CMV, it's no big deal. Up to 85% of the population actually have been exposed to CMV and have had it. But for most patients, if it causes any symptoms, they're pretty minor, maybe a cough. It is a big deal for immunocompromised patients. So patients with HIV or AIDS, patients who have a transplant, who are immunosuppressed as a result of their transplanted organ. In these patients, they can get CMV and it can be deadly. In fact, CMV retinitis is the main cause of vision loss in patients with HIV and AIDS. It can infect all parts of the body, the lungs, the eyes, the GI tract, and so on. So we're going to talk about drug therapy for both HSV and VZV as well as cytomegalovirus, also known as CMV. Influenza, I know you all know what influenza is. It can be a very serious respiratory tract infection. Major cause of morbidity and mortality. Complications can be severe, such as bronchitis or pneumonia. Again, immunocompromised patients being a significant risk, but even immunocompetent patients, if they get influenza, they could potentially have serious morbidity or mortality. Um, the viral strains for influenza are constantly undergoing evolution, so the strains will differ from year to year. So when we talk about the vaccine in particular, we'll talk about a vaccine that's formulated for the particular strains that they expect to see in a given year. Influenza, as you all know, is highly contagious. It spreads via aerosolized droplets from coughing or sneezing, enters the blood through the mucous membranes of the nose, the mouth, the eyes, replicates in the respiratory tract. Symptoms usually occur several days after exposure, usually 2 to 4 days. Symptoms, if the patient does become infected, last 5 to 6 days. Things like fever, cough, sore throat, headache, myalgia. The main way to prevent morbidity and mortality from influenza is through the vaccine. With that said, there is a drug that we'll talk about for patients who have influenza that could potentially shorten the duration of symptoms. Um, as I said, I'm not going to go into drug therapy for hepatitis B and C or RSV. You will learn hepatitis B and C in your chronic course. There are several drugs that are used to treat hepatitis B and C, as well as a hepatitis B vaccine. There is no vaccine for hepatitis C. The drugs can be pretty toxic, and they are extremely expensive. Generally, patients with hepatitis B and C, they're going to be managed by specialty providers because the drugs are so expensive. We're talking tens and tens of thousands of dollars for a course. And the insurance companies want to prevent treatment failure, so they'll generally have specialty nurses and specialty pharmacists that are managing therapy. The last virus that we have drug therapy for is RSV. This is a lower respiratory tract infection. A lot of patients will be infected with RSV, but again, kind of like CMV, the patients don't usually have severe symptoms. However, in the very young and the very old, so when I say very young, I'm talking neonates, especially preterm neonates, or the very old or even immunosuppressed patients, again, potentially transplant patients. If they contract RSV, it can be very bad. So there are some drugs that are available for patients that have RSV. They're not especially effective. If you work in pediatrics, I guarantee you'll see them, or maybe with some of those other special populations I mentioned. But by and large, you probably won't see the drugs that we use for RSV in general. But for your boards, you have to know the drugs for the herpes virus group as well as influenza. So let's move on and discuss the pharmacology of the antiviral medications. There are 3 antiviral medications that we're going to review in this lecture. The first is acyclovir, that is used for HSV and VZV. We'll also talk about ganciclovir, which is used to treat CMV. And then finally, we'll conclude by reviewing oseltamivir, which is used to treat influenza. Okay, so the first drug we'll talk about is acyclovir. The brand name is Zovirax. This drug suppresses viral DNA synthesis in members of the herpes virus family. So, as I mentioned, HSV, VZV, CMV is also a member of the herpes virus family. But this drug's activity is primarily against HSV and VZV. So, this drug suppresses viral DNA replication, but to exert its effects, the drug must first undergo activation. And a critical step in this activation is facilitated by thymidine kinase. So the selectivity of acyclovir is based on the ability of certain viruses to activate this drug. So it depends on whether or not they express the right type of thymidine kinase. The drug itself is a better substrate for thymidine kinase produced by the HSV virus than that produced by mammalian cells. So this process of activating the drug occurs almost exclusively in the HSV cell. Now, VZV can also activate thymidine kinase, but it does so to a lesser degree than HSV. So when this drug is used for VZV, the doses typically tend to be higher. And then CMV technically also can activate
thymidine kinase, but it's not as good as doing it. And so, for that reason, this drug is generally not used to treat CMV. So, in terms of therapeutic uses, I've already mentioned that it's used for HSV and VZV, and frankly, it's a first line agent for most infections caused by either of these two viruses. So, HSV generally causes infections of the genitalia, the mouth, the face, and other sites on the body. VZV, as I mentioned previously, causes chickenpox or shingles. Shingles is just a reactivation of the virus after prior exposure. So this drug can be used to treat any of those infections caused by those viruses. In many cases, the infections are mucocutaneous, and so the oral dosage form can be used, and sometimes even the topical dosage form is effective at treating those infections. Some patients, if they're immunocompromised, or if they have a systemic infection, typically those would be patients who are immunocompromised or patients that don't have an intact immune system, such as a neonate. They could develop herpes encephalitis, and the IV form would be used for those more serious infections. So, adverse effects that could be seen: nausea, vomiting, diarrhea. Again, we've mentioned this for a lot of our antimicrobial agents. This drug has also been associated with headache or vertigo. The crystallization in the kidney, I have that highlighted. I think that's an important thing to know. That only occurs with the IV form. It can lead to reversible nephrotoxicity, which manifests as increased serum creatinine and BUN. Essentially, what's happening here is that the acyclovir itself is crystallizing and it's depositing in the renal tubules of the kidney. And that can cause a form of acute renal failure, and it can be very serious. So, we'll talk about ways to minimize that when I talk about nursing implications. This drug can also cause phlebitis and pain at the injection site, so the IV site should be monitored closely. It also, in rare cases, can cause neurotoxicity. Generally, this is more likely to be seen if the drug's accumulating, symptoms such as agitation, tremors, delirium are things that could be seen with that neurotoxicity. I mentioned the drug is available orally, IV, and topically, so there are quite a few different dosage forms. Okay, in terms of individual variation, the drug's dose must be reduced if the patient has renal dysfunction. This drug, if is eliminated unchanged in the urine, the half-life can extend from 2.5 hours in a patient with normal renal function, all the way up to 20 hours in a patient who essentially is anuric. So, depending on the severity of the renal dysfunction, the dose will be reduced to varying levels. But it's important to adjust that dose for renal dysfunction. Nursing implications: the medication, if it's intravenous, should be given over at least 1 hour to decrease that crystallization that I talked about. And in addition, the patient should be well hydrated. So they should be hydrated during and then for at least 2 hours after the infusion. The topical form, education for the patient when the topical form is prescribed. It's basically to just tell them when they apply the product to their lesions that they use a rubber glove, or some kind of covering like a finger cut, so that they can discard those after they're done applying the medication. Because if not, if they apply it with their hands and then their hands aren't cleaned well, they can actually spread the virus to other parts of their body. So they have to wash their hands very well and use kind of a covering when they're applying the medication. So name recognition: cyclovir, either CI or CY. This is an indication that this is an antiviral agent that's used for any of the herpes viruses. So the first three that are listed on the slide, those are all used. So valacyclovir, famciclovir, penciclovir, and acyclovir. Those are all used for herpes simplex or varicella zoster. The last two, ganciclovir and valganciclovir, these drugs are only used for CMV infection. Now, with that said, all of these drugs get confused pretty regularly, especially like valacyclovir and valganciclovir. Those get, from a look-alike, sound-alike name perspective, these drugs get mixed up quite a bit. And unfortunately, if these drugs get mixed up, therapeutic failure can occur because, I already mentioned valacyclovir is not active against CMV. CMV is a very serious disease. And so patients who are being either receiving prophylaxis or treatment for that are at risk for therapeutic failure, and that's a big issue. So anyway, your name recognition here is just cyclovir, and that indicates that it's one of the drugs used for the herpes virus group. Safety concerns, I already started to mention this on the last slide, so your loss of drug names, acyclovir or Zovirax, valacyclovir, Valtrex, or valganciclovir, Valsite. I have listed on the slide what they're used for, and in fact, I think a lot of the newer electronic prescribing systems will list the drugs this way. They'll actually indicate what the indication is, kind of right in the line with the drug name. I know at Hopkins we did that because we saw so many errors, especially with valacyclovir and valganciclovir, that we actually put the indication right into the line item name, so that when it was chosen, the provider, they know what they're going in to treat. They know they're treating CMV, or they know they're treating HSV or VZV. And so it was like one extra piece of information to help them choose the right drug. And it also would transmit to the pharmacy and to the nurse's EMR. And the EMR is just the electronic medication administration record. And so as the nurse, you know what the diagnosis is for the patient. And if you know that patient's being treated for CMV, but then the order comes across and it's valacyclovir and it says HSV or VZV, that's an indication that, something isn't right, and you should be questioning the order. So yeah, this is a big concern. This is a big safety concern.
Okay, so let's move on to ganciclovir. This drug is used to treat CMV infections. It's also used for prophylaxis against CMV infections. So ganciclovir is a synthetic antiviral agent. It has activity against all of the herpes viruses, so it actually is active against herpes, against VZV, as well as CMV. However, we only use it for CMV. And the reason why is because this drug has very serious adverse effects associated with it. So essentially, it's too toxic. It's too toxic to use for HSV or VZV. We have other therapies that are less toxic that are just as effective. However, the other therapies that we have, namely acyclovir, does not have good activity against CMV. So that's why ganciclovir or cytovine is our drug that we would use for CMV. It works by inhibiting viral DNA polymerase. As I said, it's used either for prevention or treatment of CMV in immunocompromised patients. I mentioned when I was reviewing CMV in general that when CMV infects an immunocompetent patient, we generally don't treat it because the patient can take care of that infection on their own. However, an immunocompromised patient, CMV can be deadly. So patients who are immunocompromised, not only must they be treated if they get CMV, but they also require, in many cases, prophylaxis so that they don't contract CMV. So prevention, generally, that would be with oral therapy. Now, there's no oral dosage form of ganciclovir. However, there is another drug that's very similar to ganciclovir called valganciclovir, and that is the form that would be used specifically for prophylaxis, but it could also be used for treatment as well, but it would be the oral form of ganciclovir. So CMV can manifest in a variety of ways. CMV can infect all different tissues in the body. So patients with CMV could potentially have colitis, they could have esophagitis, they could have pneumonitis, they could have retinitis. These are the usual spots, but CMV can affect other tissues in the body as well. Adverse effects are serious with ganciclovir. So I think that's one of the major take-home points with this drug. The side effects are very serious. Granulocytopenia, and you should know what that means. Thrombocytopenia, it's also teratogenic, meaning it does cross the placenta and can cause birth defects in the developing fetus. It can also cause infertility, both female and male infertility for patients who are taking the medication. And as I said, in terms of dosage forms, it is currently only available intravenously. In the past, there was an oral form of this medication, but ganciclovir is not absorbed very well through the GI tract, so that was removed from the market. And now, the oral form that would be used to treat that would be used to treat CMV is valganciclovir. Okay, so ganciclovir can cause some serious toxicities, and that's why we limit the use of this drug to patients with CMV. Like I said, this drug is active against other forms of herpes virus or other viruses in the herpes virus family, but it is a pretty toxic drug, so it really is reserved for serious infections in CMV infections for patients who are immunocompromised. So if you look at these adverse effects, these are pretty serious adverse effects. Granulocytopenia, thrombocytopenia. The drug is considered a teratogen. It can also cause infertility. And so individual variation is important. Identifying patients who should not get this drug is an important step for anyone taking care of a patient on CMV. So it's contraindicated, meaning it should never be given to patients who are pregnant or if patients are planning to become pregnant, they need to be educated that they need to use precautions because this drug is a problem for pregnant patients. Furthermore, patients with an ANC less than 500, meaning that they have a low neutrophil count, or platelets less than 25,000, they should also not get this drug. So the nursing implications, I think they make sense based on some of the important points for ganciclovir. First of all, because this drug can lead to infertility, even in patients handling the drug, not just those ingesting the drug, this drug is handled as a hazardous substance. So for all of you, when you're on your clinicals or when you begin to work as a nurse, it's very important for you to be familiar with the hazardous substance policy wherever you work. All hospitals are required to have a policy around the handling of hazardous substances. It's a Joint Commission requirement. So you need to seek out that information when you first start your job. And then when you come into contact with these drugs that are considered hazardous substances, you need to follow the precautions outlined in those policies because they're designed to protect you as well as your patients and others. Furthermore, it's very important to educate patients who get ganciclovir on potential reproductive toxicities. So the fact that patients should not get pregnant if they're on this medication, or they shouldn't receive it if they are pregnant. Or also to inform them that sterility is possible. It's more likely with male patients, but it is possible with female patients as well. And then finally, because of the risk of granulocytopenia and thrombocytopenia, we are monitoring CBC and platelets ongoing for patients who are on this medication. And this is just an example of a hazardous substances policy. This is specific to hazardous drugs. This is the policy in place at Johns Hopkins Hospital. Like I said, wherever you work, you want to seek this information out. Usually it will have not just a listing of drugs that are included in the policy, but also kind of what's the procedure if you encounter any of these drugs, or even if one of these drugs is spilled. What do you do, for example? Okay, so the last antiviral that we'll talk about is oseltamivir. Oseltamivir, or the brand name Tamiflu, is used for prophylaxis and treatment of influenza. This drug inhibits neuraminidase, which is an enzyme responsible for viral replication, specifically for the flu virus. As I said, it's used for the treatment of influenza A and B strains, but the caveat is that for it to be effective, it really needs to be used early on in the course of the infection. I mentioned in the beginning of the lecture that generally the flu lasts for 5 to 6 days. So the whole point of using oseltamivir is to shorten the duration of the flu. So the likelihood of it being effective at doing that, the earlier that it's administered in the course of the infection, the more likely it is to be effective. So it generally would not be prescribed if a patient presented to your clinic and they saw the nurse practitioner or the physician and the patient explained that their symptoms had been going on for 4 days or so, then they would not even prescribe oseltamivir at that point. Um, so it's generally within 2 days of the onset of symptoms. It can also be used for prophylaxis. So for prophylaxis, it's not indicated for all patients. There are some studies with at-risk patients who are in close quarters or close contact, who potentially in close contact with other patients who are infected with the flu, for example, nursing home residents. So there are studies that have been done in that specific setting where prophylaxis with oseltamivir was used to prevent an outbreak in that particular facility or in facilities that were enrolled in the study, and the results were positive. So prophylaxis can be used. Basically, the patient takes the medication once a day, and that would be again at the onset of other residents in that particular long-term care facility who are presenting with the flu. It could also be used in families. So if a couple people in a family have the flu and in an effort to prevent other people in the family from getting the flu, some providers will prescribe oseltamivir prophylaxis, especially if there are high-risk patients in the household. So if there are elderly patients in the household that are potentially immunocompromised, or maybe young patients, little children, then for those patients, it would be appropriate to prescribe prophylaxis. So you might be working in a clinic setting where you see, a patient that's a patient coming in with the flu, and then maybe the provider writing prescriptions for family members. For the most part, this drug is very well tolerated. So there really aren't a lot of things that we worry about with this drug. Really, the main thing is that if it's used for treatment, that it is prescribed early on in the course of the infection. But things that we could worry about, nausea, vomiting, a lot of the anti-infectives can cause nausea and vomiting. There is a risk for hypersensitivity reactions, which can be severe. Anaphylaxis, even serious skin reactions like toxic epidermal necrolysis or Stevens-Johnson syndrome, they are very rare. There also have been reports of neuropsychiatric effects. The problem with the neuropsychiatric effects is that those types of effects can occur in patients on the flu, or I'm not on the flu, with the flu. So it's a little hard to tease out, is it the drug or is it kind of the underlying illness? But nevertheless, it is something you could educate your patients to look out for. One drug interaction to point out is the live activated influenza vaccine. So patients on oseltamivir should not get the vaccine. I believe there's a certain time frame with which they shouldn't get the vaccine, and that's because it can decrease the effectiveness of the vaccine. Some nursing implications. You want to educate patients to look out for signs of allergy, and if they occur, they need to report it. And then, like I said, the patient might ultimately get the influenza vaccine, but you want to make sure that enough time has elapsed between when they take oseltamivir and when the live activated influenza vaccine is administered. The way to manage that really is to just give the other form of the vaccine. So you will also learn about vaccines this week. In that lecture, I talk about the different forms of the influenza vaccine. There's an inactivated influenza vaccine. So for patients who have gotten oseltamivir, they can get the inactivated form of the vaccine.
All right, so if you have questions, please post them to the discussion board, and thanks for listening.